Welcome to the Wildland Firefighter Health Webinar Series. Our goal with this event has been to pull together some of the latest science relevant to firefighter physical and mental well-being, as well as some of the examples of how this science is being applied. My name is Vita Wright, and I work for the Rocky Mountain Research Station's Missoula Fire Sciences Lab in Missoula, Montana. I'm here today on behalf of the Northern Rockies Fire Science Network. The network is part of a national network funded by the Joint Fire Science Program to accelerate the awareness, understanding, and use of fire and fuel science. In essence, we bring people together and share knowledge. This webinar series has been organized by several of the Joint Fire Science Program's Western Fire Science Exchanges, including the Northern Rockies, Northwest, Great Basin, Southern Rockies, and California. We want to give a big thank you to the speakers for presenting on these important topics today, as well as the many people who have helped us organize these sessions. I would also like to thank all the coordinators of the Fire Science Exchanges that I just mentioned. Our topic today is physical health, so I encourage you to take care of yourselves, stand up and stretch if you need to. And first up, we have Joe Dmitrovich to provide some opening remarks. He's a project leader and an exercise physiologist with the USDA Forest Service's National Technology and Development Program. Take it away, Joe.
Thanks, Vita. It's a pleasure to kick off these next 3 days. This is a very important topic, I think, for all of us, as wildland firefighters are put under more stress, as we all know, longer fire seasons, more intense fire seasons. Human health is probably our greatest resource. As we look back, fire behavior has been studied since the Man Gulch fire. But when we look at, I would say, firefighter health, physical, mental, it was really the South Canyon fire that was the beginning of that. And so we are still at its infancy. But so much has been done over the last 5 to 10 years that there's so much great information. And as a individual from a physiological perspective, we're over 99% exactly the same at a DNA level. It's yet that 1% that makes it so interesting and so much fun, especially as a physiologist, when you look at physical health, because we all respond differently. And so the information that's going to be presented today and over the next 2 days is ways that you can take that information back and make some decisions to help yourself and some of your colleagues as well. Today's topic, looking at smoke, female health, sleep, the job demands, and then fitness at that unit level, are all critical topics that we're going to be dealing with on a daily basis, probably for the rest of our lives in wildland fire management. The speakers today that have been brought in are from across the country and some of the leading experts in the topics they're going to be presenting on. It's going to be an amazing day today and the next 2 days as well. And so, again, this information is some of the top information. Some of these studies are extremely recent. It is the tip of the spear when it comes to wildland firefighter health and safety. And the key with that also is that we're talking about the body and the mind, and those two things have to come together. You can have the strongest individual that has some sort of mental disease is not the right word, but it maybe is not mentally strong due to some of the things that are going to be talked about tomorrow. Or you can have somebody that is extremely mentally resilient, but maybe doesn't have the physical capacity to do the job that we're going to ask them to perform. So it cannot be a one or the other. These things have to come together to form a well-rounded and healthy individual. And so with that, enjoy today and the next 2 days to build that toolbox. I'm going to turn it over now to our first speaker, Kat Navarro. Kat Navarro works for the NIOSH Western States office. I've had the pleasure of working with Kat, I would say, for the last 5 years on different projects. Kat has her PhD from the University of California, Berkeley. We don't hold that against her. But again, Kat has worked as a wildland firefighter. She's worked as a research assistant looking at exposure. She's managing a large collaborative study between NIOSH and the U.S. Forest Service as well on firefighter health. And so with that, I'm going to now turn it over to Dr. Kat Navarro, Research Industrial Hygienist for the NIOSH Western States Office.
Thank you, Joe. And hopefully everyone can hear me and see my slides.
Looks great.
Great. So yeah, as Joe said, my main area of focus ever since my dissertation actually has been smoke exposure for wildland firefighters. So today I will be giving an overview of some of the work that I completed with Joe while working for the U.S. Forest Service, doing a risk assessment of smoke, as well as looking at what our firefighters are exposed to out on the line. And then I'll be giving an overview of the work that we have here at NIOSH that we'll hopefully be publishing later this year on our wildland firefighter health effects and exposure study. So during the combustion phase, during the entire fire process, many compounds, many gases, many particulate matter can be emitted as smoke, and is what we are exposed to as fire personnel out there. So smoke compounds can consist of volatile organic compounds, polycyclic aromatic hydrocarbons, some of which are known to cause cancer, nitric oxide, particulate matter, in different size fractions, and I'll go over this in the next slide. Carbon monoxide, which is really important when thinking about acute exposures in health. You know, carbon monoxide exposure can lead to nausea and fatigue, and just having that situational awareness that can really be affected by exposure to carbon monoxide, as well as carbon dioxide. So a lot of wildland firefighter work, as well as smoke exposure for the public, have really looked at exposure to particulate matter, so PM. And the way that we measure PM is based on its size. So PM 2.5 is a smaller size fraction, smaller than a dust particle, smaller than a human hair. And when we look at emission studies of wildland fire smoke, we see that smoke is mostly in that smaller size fraction range. And size really does matter when looking at exposure to PM and then looking at subsequent health effects for PM exposure. Because the smaller the size fraction, the deeper it can get into your lungs. So those smaller sizes can get all the way down into your lower respiratory tract, into your alveolar region, and then be kind of systemically transported throughout your body through your blood. And PM is not only a particle, but it can also have compounds attached to it as well. So those polycyclic aromatic hydrocarbons can be attached to a PM in the air and then get transported down into your lungs and through your body. So when measuring compounds in smoke, most exposure assessments that have been done thus far have really focused on particulate matter, both in that smaller PM 2.4 range, but also in the 4 micron range as well, because that's what OSHA regulates at. And so most of the work when measuring exposures have really looked at those size fractions, as well as looking at PM as kind of this sentinel compound within smoke. So past exposure assessments have looked at both prescribed fire exposures as well as wildland fire exposures. And when we compare that to the OSHA permissible exposure limit, which is kind of where we have regulatory standards for, it's at that 5 milligram per meter cubed level, which many studies that you can see here don't reach that threshold. So to really account for the fact that PM is not just an inert dust particle, it's comprised of many different compounds, and also to take into account of the arduous nature of wildland firefighting and the longer work shifts, the National Wildfire Coordinating Group came up with a recommended occupational exposure limit of 0.7. And we do see both for prescribed fire and wildfire studies that some samples do cross that threshold above that occupational exposure limit. We saw in the work that Joe and I did that I'll present on in a little bit, as well as the earlier work by Tim Reinhart and George Broyles, that around 20% of all the samples that we collected out on wildfires are exceeding that occupational exposure limit. So then when we go to look at, what has been done as far as health studies and trying to understand what are the health effects when looking at exposure to smoke, some work that was done in the Southeast by Femi Adatona found that on prescribed fires, wildland firefighters at the end of shifts, so this was looking at pre-shift, post-shift, found that there was an increase in urinary mutagenicity, an increase in oxidative stress, increase of exposure to PAHs as measured in the urine, increases of different inflammatory markers, including interleukin-8 and C-reactive protein. So all of these measures are really intermediary markers of health. So when looking, they've been associated with cardiovascular disease and cancer. So then when we look at what has been done on wildfires, looking at pre and post shift, a NIOSH study published in 2014 found a decrease in lung function. And then really the first work that has been done to look at long-term health effects for wildland firefighting was some work done by Aaron Simmons at University of Montana. And they did a big survey study. They had around 500 participants and found that with the increase of years of wildland firefighting, it was associated with an increase in blood pressure as well as an increase in heart arrhythmia. So 2 cardiovascular outcomes, as well as an increase in having knee surgery, which at first I thought was kind of strange, but then once you put on a pack and hike down a steep hill, it makes a lot of sense. So then some additional work has been looked at, kind of what happens from the preseason to the postseason. And some early work in California found an increase in airway responsiveness, another decrease in lung function, and then some additional work by NIOSH found that decrease in lung function, an increase in upper and lower respiratory symptom scores, and again, an increase in inflammation. And just to note from the last few slides that I've presented on, there's been all of this is kind of in this more acute phase. So looking at the beginning and the end of a shift or the beginning and the end of a season, but we really don't have a good sense of what happens throughout a career, throughout a lifetime of wildland firefighting. So some of that work that has been done was done by the National Wildfire Coordinating Group, looking at the cause of death for the last 10 years. And for the most recent report that we've written from 2007 to 2016, we saw that heart attacks were the leading cause of death, followed by vehicle and aircraft accidents. And that's to note too, that the previous 10 years, aircraft and vehicle were the top 2 and heart attacks were number 3, but we're now seeing heart attacks rising to the top. So to really start to get a handle of what are the long-term health risks for wildland firefighters, working with Joe Dmitrovich and other researchers, we really wanted to quantify this. We wanted to put a number. What is the lifetime risk of lung cancer and cardiovascular disease from exposure to PM from smoke? And we did this by using some existing exposure response relationships, and we input our own field measurements that we took for particulate matter exposure, as well as using heart rate to estimate breathing rate. So we know what is the dose, how much PM are you being exposed to, and what is getting into your body. So to complete this study, we used some exposure response relationships that were developed by Art and Pope, and these were aggregating together epidemiology studies looking at exposure to PM and then the outcomes of lung cancer and cardiovascular disease. So down at the x-axis, you have the daily dose of PM, and your y-axis is your relative risk of developing lung cancer and cardiovascular disease. So these studies included health exposures from cigarette smokers, exposures for secondhand smokers, and then exposures for community ambient levels of PM. And they plotted this all along a curve and created these relationships and equation that relates the dose of PM to your outcome of interest. And for our wildland firefighter exposures that we had measured out on the line and plugged into this equation, we found that our wildland firefighter exposures were really similar to the ambient community exposures and then the lower end of the secondhand smokers. So for this equation, we had to calculate our dose. So we used our exposure concentration were the PM measurements that we took out on the line. And then we wanted to know of that exposure, how much are you breathing in? How many liters per minute are you breathing? And so we took heart rate that was measured out on the fire line and estimated breathing rate from that. We used shift duration from the exposure measurements that we took. We had around a 14-hour shift that we used as our average. And then for the frequency of exposure, so how many days per year are folks working and how many years are firefighters working throughout their career, that was a little bit tricky because we don't really have good data of how many days per year people are out and how many years of their career. So for this, we came up with two different exposure scenarios. So I picked a short season, which equated to a 500-hour overtime season, and then shift days per year for a long season equated to 1,000 hours of overtime. So with that, we calculated the excess risk of lung cancer and cardiovascular disease, and we varied the career duration from 5 to 25 years. So thinking of a 5-year career as like someone working through college, and a 25-year career, kind of your hotshot superintendent or a captain who's been, doing this their entire career. And found, kind of looking at that most conservative estimate of a 5-year career for a short season firefighter, we calculate an excess risk of lung cancer of 8% and an excess risk of cardiovascular disease of 16%. If we flip that all the way around and go to a long season 25-year career, we calculated an excess risk of lung cancer of 43% and an excess risk of cardiovascular disease of 30%. So kind of just giving you all an update on the smoke exposure work that we recently published on. This we published last year was a update from the 2009 to 12 smoke exposure assessment done by Tim Reinhardt and George Broyles. We went out and reevaluated smoke exposure out on the line just to see, have exposures changed post that 2012 smoke assessment and mitigation measures that were recommended after that. So for that study, we took direct observations and measurements across over 80 Western wildfires. We measured shift exposure to PM4, and we did this across various crew types as well as job tasks performed. And so to kind of get the most out of our data, I partnered with the WECAN study, which is the Western Wildfire Experiment for Cloud Chemistry, Aerosol Absorption, and Nitrogen. And so what they did is they went out and measured real-time PM, as well as different volatile organic compounds using direct read instrument, all put in a plane, and they flew through a lot of smoke plumes. And what they did was they were able to calculate ratios of VOC concentrations to PM. And so what we did was we used their ratio that they had calculated with our PM measurements so that we could use our measurements to estimate VOC concentrations. And so for the study, we decided to estimate exposure to acrolein, benzene, and formaldehyde, just to try and see, can we use the data that we've already collected to understand more exposures from smoke for wildland firefighters. So for our study, we found that, I skipped a slide. So when we compare our full shift exposures for PM to that OSHA occupational exposure limit, we found that none of them exceeded it at that 5 milligram per meter cubed level, but we did find that around 19% of our samples collected did exceed that NWCG recommended exposure limit. When looking at the volatile organic compounds that we estimated, we found that only formaldehyde exceeded the NIOSH recommended exposure limit, as well as the American Council for Governmental Industrial Hygienists, which is a very long acronym of ACGIH threshold limit value. So we did find, some were exceeding those thresholds that have been set for occupational settings. When looking across crew type, we found that type 1 crews had the highest exposures, followed by engine crews. And I did put that dashed line on there is the NWCG recommended level. And then looking across job tasks, we found that direct suppression, as well as holding and mop up, had the highest exposures. And then we also asked at the end of shift for everyone to qualitatively rate their exposure to smoke. And we found this really interesting and great relationship that, you know, the qualitative measures track very well with the quantitative measures. So firefighters can be a great tool for their own exposure to smoke. And I found this really interesting, especially because when we were asking this question, you know, everyone's joking around, everyone's just, you know, laughing at what they're saying, but we found that firefighters can be their own great exposure tool. So our conclusions from this study have been that exposures were consistent with previous exposure assessments that work done by Tim and George between 2009 to 12. Like I just said, firefighter assessment of smoke may be a great tool to understand exposures in this environment, especially because the work that we do to measure exposure is very time and resource intensive. I really am interested in seeing if this can be used to get more data. We found that there were higher exposures for type 1 crew, as well as those performing direct suppression, holding, and mop up. And then some mitigation recommendations that came out of this work, as well as the earlier work by Tim and George, include minimizing mop up when possible, you know, using patrols instead of going further and further in, reducing exposure by limiting shift length and rotating crews in and out of heavy smoke areas, developing a medical surveillance program so that we can track health over time, developing more fire-specific occupational exposure limits. Like you saw in that first graph, you know, the OSHA PEL, the permissible exposure limit, is at 5 milligram per meter cubed. And that was really under the assumption that this was inert dust. And we know that smoke really doesn't fit that category. Create training for firefighters on the hazards of smoke. I believe that everyone should really understand, you know, what they're getting into, what the risk is. And I think it's really hard when you have an environment that's filled with so many risks, especially risks that are, you know, immediate to your health and safety. And then to start thinking about these risks that we can't see, that we may be exposed to a little bit each day, or only be exposed to a lot every, you know, few months or something. So, and also really trying to limit exposure when you are trying to rest and recover and locating ICPs out of historically smoky areas. So next, I want to just give a preview of the work that we have here at NIOSH, the Wildland Firefighter Exposure and Health Effects Study. And this is really trying to get at what happens over multiple seasons. You know, we always hear firefighters can recover in the off season, you know, they come back, they're able to recover some of these, you know, possible lung function decrements or these increases in inflammation, but we really don't know. So with that, we partnered with the U.S. Forest Service as well as DOI to follow 6 federal fire crews over 2 years. It was supposed to be 3, but due to COVID, we had to cut it short. So with this project, we interacted with crews and study participants 2 to 3 times per year. So our first year in 2018, we went out and did a preseason assessment as well as a postseason assessment. And then again, we did that in 2019, as well as went out to a wildfire incident. So for the study, we collected lots of data at these pre and post-season assessments, as well as that mid-season, we collected a lot of the same data. So we had everyone fill out a questionnaire so we can look at risk factors, demographics, any kind of history of medical conditions. We collected blood to look at cardiovascular function. We collected pulse wave velocity, which is arterial stiffness, and looking at platelet function as well as a cardiovascular outcome. Looking at kidney function, mostly through urine, a little bit of blood, looking at kidney injury, dehydration, some markers of rhabdomyolysis. We collected pulmonary function through spirometry, as well as looking at acute inflammation in the lungs by the fractional exhaled nitric oxide test, and collecting blood to look at inflammation markers, as well as looking at noise-induced hearing loss. And then for the section of the study that I lead, which is the exposure assessment component, this was during that mid-season wildfire incident. We went out and did air sampling for some volatile organic compounds, including benzene, toluene, ethylbenzene, xylene, aldehydes, including formaldehyde, and carbon monoxide. So then we're looking in the urine for urinary metabolites, so of PAHs, which are those polycyclic aromatic hydrocarbons, as well as levo-glucosan, which is a wood smoke metabolite marker. As we also asked all of our crews who participated in this study to create a daily diary over the entire fire season to mark the types of job tasks that they performed that day, as well as the time that they performed them as well. So I hope to use that to pair with some of that exposure data so that we can kind of create these cumulative estimates of exposure for our study. So just kind of a preview of some of the results that we have so far. Our first day that we were with our crew, they were performing indirect line prep. The second day, they were performing indirect prep. In addition, they did a small burn operation kind of in the later afternoon, evening of that area that they had prepped. And then day 3 were engaged in mop up. So we see that formaldehyde was elevated on day 2, probably during that burn operation. We see for BTEX as a combined measure, highest on day 3 with some elevated concentrations on day 2. And then looking at level glucosan, so this is that marker of wood smoke that we measured in the urine. And when looking at pre-post shift, pretty similar on day 1 and day 2, but really seeing that larger difference on day 3 when folks were engaged in mop up, and also possibly kind of a cumulative effect from that burn on day 2. So just some initial conclusions so far, elevated formaldehyde exposures during day 2. We see those higher wood smoke markers on post-shift day 3, post-mop-up, and looking at a future analysis, working again with the U.S. Forest Service as well as the University of Montana to take that crew diary data as well as the smoke data that we've collected over those many seasons to really create a job exposure matrix. Can we use estimate for job tasks what people's PM exposure is, as well as creating a cumulative exposure metric for across a whole season. And then another preview of the work that we have going on is looking at exposures in the wildland urban interface. So what happens when firefighters experience structural firefighting exposures without wearing PPE used in structural response or decom procedures used in structural response? So for this project, we are partnering with, this is a project that's nested within the firefighter cancer cohort study. It's funded by NIOSH, but led through the universities of Arizona and Miami. And for this project, we're looking at biomarkers of exposure and effect. So we collected blood or serum at the beginning of our study, and then post, what we called post-fire season. It was kind of a year out. And this is working with departments in Southern California. And so in the blood, we're looking at more chronic exposures of those per and polyfluoral alkyl substances. You may have heard of them as PFAS. Flame retardants. We're also looking at epigenetic changes, so changes in DNA across one fire season, and measuring that through microRNA expression and DNA methylation. And then looking at more acute exposures and kind of what happens at the fire incident level. We collected urine at the beginning of the study and then post-fire incident. So right as their shift was ending, we collected urine again, and we're measuring that for metals, volatile organic compounds, including those PAHs and flame retardants as well. So with that, I just want to thank everyone who's participated in the studies that we have ongoing, but also all the work that I have done in the past. I've learned so much from people, and just really being out there and getting to experience it has been great from both the research perspective, but also just practically and how to really, design this work and make recommendations. I'd like to thank our research partners, as well as the over 50 NIOSH staff that I have over 5 divisions. And just as a preview for everyone, I will be doing a survey study this fire season, really trying to look at worker well-being as well as exposure to smoke. So if you're a federal firefighter, I would be happy to invite you to participate in that survey project this summer. So thanks.
Thank you, Kat. Obviously, there's a lot of interest in this work, and we just so appreciate that you're doing the work and also sharing the results with us. Unfortunately, I'm not going to have time to ask you questions right now, but there are several questions in the Q&A box, and some of the themes that I've noticed, one is around prescribed fire and whether there's a difference with wildland fire, and then also some questions about smoke for firefighters in the WUI. So you can either answer those in the box, or if you want to wait till the Q&A, which will be at 1:15 Mountain Time, we could also talk about some of them at that time. Will you be with us during that panel?
Yeah, I will.
Excellent. Okay, so take a look at the Q&A. Thank you. Okay, well, without further ado, I'm going to move on to our next speaker, and that's Alesia Jung. And she's talking about female firefighters and reproductive health, what we know and where we're going.
All right, thank you, Vita. Let me go ahead and share. All right, can you see the full presentation screen?
Yes, it looks great.
Okay, great, thanks. Okay, so good morning, everyone. My name is Alesia Jung. I'm a postdoctoral researcher at the University of Arizona. And a little bit of my background, I've studied environmental toxicology at UC Davis and epidemiology here at the University of Arizona, where I've been able to work on research projects focused on women's health, reproductive health outcomes in female firefighters, as well as examining the value of epigenetic markers as biomarkers of firefighter exposures and potentially future disease risk. And actually, Kat had mentioned an epigenetic study based on, I think it was WUI firefighters that I'll actually be working on later this summer. So more to come soon. Before I get started, I would just like to acknowledge that the University of Arizona occupies the original homelands of the Thana Otham and Pascua Yaqui nations, and take a moment to celebrate and honor the original inhabitants of this land and the sacred lands of all indigenous peoples. All right, just a very brief background to make sure everyone gets on the same page. So among women, many adverse reproductive and birth outcomes share several common risk factors, and they can be broadly categorized as social, personal, and economic characteristics, probably the most important being maternal age and age at conception. Behavioral risk factors, including alcohol consumption, BMI, smoking, and stress. Obstetric and reproductive history. So if a woman has had a prior adverse outcome, some reproductive outcomes, your risk can increase because there's a pattern of reoccurrence for these events, as well as environmental and occupational exposures. So in the context of firefighting, some environmental exposures have been associated with adverse reproductive outcomes in non-firefighters, including ambient or environmental temperatures, stress, air pollution or wildfire smoke exposures, as well as shift work and sleep disruption. So during this talk today, I'd like to summarize what recent research tells us about the risk of reproductive and birth outcomes in women firefighters, as well as touch on what are current or upcoming research projects that are planned. All right, so for miscarriage and preterm birth, to get started, a miscarriage is also commonly referred to as an early pregnancy loss or spontaneous abortion. It occurs before gestational week 20, and actually the majority of them occur within the first trimester. It is the most common adverse birth outcome, and within, I think recent estimates state that about 10 to 20% of all clinical pregnancies will end in a miscarriage. That estimate may be even higher just because of the difficulty of recognizing and diagnosing miscarriages, since they can occur so early within a pregnancy. Miscarriages are also associated with short-term economic consequences, as well as psychological consequences for the mother and father, and future health consequences for the mother. A preterm birth is a live birth that occurs before gestational week 37. So generally pregnancies that will occur, or births that occur at least 3 weeks before the expected due date. In 2010, there were almost 15 million preterm births worldwide, which made up about 11% of all live births. And in the US, that estimate is about 10%. Preterm births are the leading cause of infant mortality. mostly due to preterm births that occur very early on, so about week 32 or sooner. And babies who are born prematurely can often have an increased risk for morbidities later in life, as well as have an economic impact on the parents as well as the healthcare system. So much of what we know about miscarriage and preterm birth occurrence in firefighters is based on the work of Dr. Sarah Janke from the Center for Fire Rescue and EMS Health Research at NDRI USA, based on her 2 studies. The first was a study that was meant to obtain preliminary data on pregnancy outcomes among career firefighters. And the second was to kind of expand her research and look at the work environment, health, and perceived experiences of women firefighters. Both of these studies utilized a kind of like a cross-sectional survey design. So all of the data that we have is self-reported by the participants. So miscarriage and preterm birth in firefighters, based on Sarah's work and my work, we know that an estimated 20% of all pregnancies to firefighters have been reported to end in a miscarriage. For context, here are some rates from other US-based studies, which are generally between 10 and 12%. And we also know that firefighters are more than 2 times as likely to report that their most recent pregnancy resulted in a miscarriage compared to non-firefighters. When we look at the data for preterm births, we see similar patterns where an estimated 12 to about 17% of pregnancies resulted in a reported preterm birth, and other US-based studies in non-firefighting populations reported lower prevalences. And when we made a comparison, we see that firefighters are more than 1.5 times likely to report that their most recent pregnancy resulted in a preterm birth compared to non-firefighters. We also have research that has looked at associations between volunteer status and wildland firefighter status and the risk of these outcomes. And here's a graph. I'll kind of explain it because there's a little bit going on here. What we can see is that the risk for volunteers is increased compared to career firefighters. However, when you stratify firefighters based on whether or not they have any wildland firefighter activity, we can see that among wildland and WUI firefighters, the risk is even greater, 2.5 compared to 1.4 in structural firefighters. And again, when I looked at the risk preterm birth data, we see similar patterns where volunteers have an increased risk of experiencing a preterm birth compared to career firefighters. And this risk is even greater among wildland and WUI firefighters. So seeing these 2 main points, what can we say? So for this increased risk that we're seeing in volunteers versus career firefighters, some things that could contribute to this include financial barriers, since volunteers and volunteer departments may have reduced access to resources, including support services and staff, protective equipment and technologies, training and as well as trained personnel. Volunteers can also have potential additional exposures from their primary occupations that these studies were not able to capture. And we also know that there are differences in the mental strain experienced by volunteers compared to career firefighters, where volunteer firefighters reported significantly elevated levels of depression, post-traumatic stress, and suicidal symptoms. And then for looking at the fact that risk varied based on whether or not you were a wildland or WUI firefighter, what we can say is that differences in the total fireground exposure coupled with increase in the intensity and frequency of wildland fires in recent years could definitely have contributed to this. And this supports other research that has shown that there has been an increase in also a variety of adverse health outcomes within wildland fire impacted communities. Wildland and WUI firefighters also have unique duties not shared by structural firefighters that could contribute to additional physical and physiological burdens. And there might be some potential differences in the mental strain experienced by these firefighters as well, although this is based on a limited sample of wildland firefighters, so the results should be interpreted cautiously. So in summary, this suggests that we need research that's tailored specifically to explore these potential differences to kind of explore the mechanisms for why these groups of firefighters appear to have an increased risk for miscarriages and preterm births. This research also looked at the work restrictions as a risk factor for preterm birth risk. And what we saw is that women who began work restrictions during their second trimester actually had 2/3 the risk of preterm birth compared to those who started later in their pregnancy or didn't restrict at all. And this finding actually supports a lot of previous studies that suggest that there may be some kind of critical exposure period for preterm births during pregnancy. These studies reported that exposure to air pollution and non-occupational wildfire smoke during pregnancy were associated with an increased risk of preterm births, where greater risk was actually seen during the later weeks of pregnancy, particularly during the second trimester. So what this suggests for me is that we need to collect information on the types of work restrictions that firefighters take during their pregnancies, as well as examine the temporality between when exposures and restrictions occur to better inform department policies. All right, moving on to measures of fertility and infertility. Infertility the definition of infertility can vary widely, but generally it's thought to be the inability to become pregnant after 12 months of regular intercourse without the use of contraceptives. And it can be couple specific, meaning a man and a woman who are experiencing infertility together could go on to successfully conceive a child with different partners. It can also be multifactorial, meaning multiple reasons. And for females, infertility involves the disruption of female reproductive processes. Here's a list of some common diagnoses. And about 48.5 million couples are affected by infertility worldwide. In the US, it has been estimated that 12.5% of US women have experienced infertility. Another concept I'd like to introduce is anti-Müllerian hormone, or AMH. It is a glycoprotein hormone that is secreted by the granulosa cells of ovarian follicles. So essentially the cells that have the potential to become eggs, and if they are fertilized, could possibly develop into a child. AMH is a clinical marker of ovarian reserve, meaning the reproductive potential within ovaries. And AMH levels peak around age 25 before they begin to steadily decline. And this pattern tends to mirror the decline in the number of oocytes, or developing eggs, within ovaries. AMH levels are strongly associated with fertility, as well as age menopause, and potentially the risk of miscarriage and preterm birth. And in recent years, studies have looked to examine if it could be a potential biomarker for exposures that may affect the ovary. Some of these exposures that have been assessed include inhaled environmental toxicants, as well as stress. So what I'll present today on infertility and fertility treatments is based on data from an upcoming manuscript that I'm preparing, so very new. we had a study which involved 562 US female firefighters, and we found that 30% of them reported that they had previously experienced infertility. Again, for context, within the US, it's estimated that about 12.5% of women have experienced infertility. Unlike what we saw with preterm birth and miscarriage risk, volunteer status and wildland firefighter status did not appear to be associated with the risk of infertility. However, we did find that volunteers in wildland and WUI firefighters were less likely to utilize ART or assisted reproductive technology, which is probably connected to the fact that these treatments can be rather cost prohibitive and not always covered by insurance. We also observed that length of time working as a firefighter was associated with a modest increased risk of infertility, even after adjustment for age. And that women firefighters who had experienced infertility also reported, or about 80% reported that they had also sought medical care or advice from a provider, which is on par with national estimates. And over half of them had utilized some form of fertility treatments. Whereas another study that looked at firefighters, women firefighters, regardless of infertility, found that 7 to 15% of them had utilized fertility treatments. So our knowledge of AMH levels in firefighters is based on research that was actually published earlier this month by my colleague, Samantha Davidson, where she recruited firefighters and non-firefighters to provide dried blood spot samples, essentially pricking their fingers and squeezing some blood out onto a paper card before mailing it back to us. We were able to take these dried blood spots and analyze their AMH levels, and found that AMH levels in firefighters were 33% lower than those among non-firefighters, even after adjustment for age and BMI, which is a rather significant difference. For context, a similar magnitude of difference has been seen in studies that have compared smokers with non-smokers. We didn't see any associations between occupational factors and AMH levels, but this study was rather small. And so studies that recruit larger numbers of participants, as well as incorporate maybe repeated sampling over time, are required, since AMH levels can rise and fall to some extent based on external factors. All right, I'd like to finish up my talk kind of describing some of the ongoing studies, as well as the firefighter cancer cohort study. The firefighter cancer cohort study, or FFCCS, began in 2016, and it's a research project that provides a national framework to collect and integrate surveys, biomarkers, and exposure data collected from firefighters, focused on examining carcinogenic exposures and health effects. Our long-term goal is to recruit and follow 10,000 firefighters over a 30-year period. At the moment, we're about a quarter of the way to meeting our recruitment goal, with participants from departments across the US. And for more information, please check out the website. So within the FFCCS, there are a number of ongoing sub-studies. Kat touched on our WUI sub-study, but some studies that I would like to highlight include the women's study and our very recent Wildland study. So this women firefighter study is based a lot on the research that I've just presented that has either been recently published or is about to be published, where we want to evaluate the causes of stress, cancer, and adverse reproductive health effects in women firefighters, as well as plan interventions to hopefully mitigate some of these conditions, where we are analyzing AMH levels, epigenetic biomarkers, and stress data. At the moment, recruitment is almost complete. We have far exceeded our initial recruitment goal, which is great, considering the fact that we considering the fact that it's rather hard to recruit a significant number of women firefighters, especially for a study that involves biological sampling. And we plan to, we're in the process of returning individual results consisting of personalized AMH results and stress data. And we'll also be beginning formal analyses of this data later this year. We're also beginning beta testing of a peer support intervention, and we'll be planning follow-up visits with our participating fire departments later this fall. So this is our newest FFCCS study. It began fall of last year, where we're hoping to evaluate and reduce cancer risk in wildland firefighters. We are working with the Wildfire Conservancy and Colorado State University to recruit departments or to recruit firefighters in California, Colorado, and Wyoming. Our goal is to recruit 100 wildland new recruits and 200 incumbent wildland firefighters across multiple fire departments. Currently, we have 132 firefighters recruited from Colorado and California, and we're hoping that we will increase our recruitment over the summer as well as get to some of our Wyoming departments very soon. During this study, it's kind of similar to what Kat discussed for the WUI firefighters, where we're combining surveys and blood samples to look at cancer risk and urine samples to measure urinary PAH metabolites. And we'll also be providing confidential report back of these results to our individual participants. And something that is rather new and exciting is we're hoping that we'll be able to use the exposure data that we collect to identify potential interventions to reduce carcinogenic exposures and test the effectiveness of implementing these interventions if and when we can obtain additional funding. So if you're a department or you know a department that would be interested in this and has ideas about how we can obtain some more funding, please feel free to reach out to me. And with that, I'd like to thank my colleagues at the University of Arizona, NDRI USA, Women in Fire. There is a complete list of references at the end that I can share later if anyone is interested. And again, reach out to me if you have any questions via email or social media, or you can reach out to Dr. Jeffrey Burgess, who is the principal investigator of the FFCCS. Thank you.
Thank you, Alicia. That's a lot to digest. Really appreciate you sharing it today, especially even the newest and latest stuff. So we won't have times for questions right now, but there are some questions in the box about how you define volunteer and also different types of firefighters that you might have been referencing. So you can either answer those in the box or we can talk about them during the panel later. Will you be with us on the panel at 1:15 Mountain Time?
Yes, I will be there.
Okay, excellent. Thank you so much, Alicia. Okay, our next presenter is Randy Brooks from the University of Idaho, Department of Forest, Rangeland, and Fire Sciences, and he'll be talking to us about sleep matters, how it affects mental and physical health.
Okay, thank you, Vita. I will share my screen here. Okay, can we see that?
Yes, looks great.
Okay, thanks. I appreciate the opportunity. We've had some great speakers before this, and I think a lot of what they've mentioned kind of leads into what I'm going to talk about, and it's about sleep and how it affects our mental and physical health. But first, I'd like to acknowledge Brett Rogers, aka Smiley, with the who's the Occupational Safety and Health Manager on the Nez Perce Clearwater National Forest. And Brett and I have been working together teaching mental health first aid to U.S. Forest Service employees on the Nez Clear. And Brett's also been a big proponent of some of the sleep and fatigue research I've been doing. I'd also like to acknowledge Dr. Stephen James and Dr. Amy Bender for their guidance on our sleep research. I'm not going to really present any of my sleep research. We've been working with Wildland firefighters since 2016, looking at sleep quality and quantity as well as fatigue. And that paper should be published here before long. So we'll be looking for that. But I always like to define my terms when I'm talking to an audience. So what is sleep? And it's just a condition where the mind and body typically it recurs for several hours every night, and the nervous system is inactive, the eyes are closed, the postural muscles are relaxed, and consciousness is, here we go. Consciousness is practically suspended. And I've had a lot of firefighters say, yeah, that happens when I drink a lot. So we're not talking about drinking sleep, but I like the Merriam-Webster dictionary the best. That says the natural periodic suspension of consciousness during which the powers of the body are restored. And that to me means a lot. The powers of the body are restored. Now there's sleep quantity and quality. So that's how much and how well. We'll kind of get into that a little bit because you can get a lot of sleep, but if it's not quality sleep, it can make a difference. And there's two types of sleep that I want to just briefly talk about with some terms, and that's NREM and REM. And NREM is the non-rapid eye movement stage, and that's a dreamless state. And it's where our topically slow and high voltage of brain waves are taking place. Our breathing and our heart rate slows down, and our blood pressure gets lowered. Now, the REM and MREM sleep goes in 90-minute cycles. And so we'll be in the NREM for about 90 minutes, and then we'll switch over into the REM, which I'll talk about here in just a minute. But anyway, there's 4 stages with non-rapid eye movement. And that's stage 1, where eyes are closed, but we're easy to wake and we can actually hear things that are going on around us. Stage 2 is where we become, our sleep is lighter. We have a slower heart rate and our body temperature decreases. Then stage 3 and stage 4 are where our body starts to take care of itself. Stage 3 is harder to wake, and stage 4 is where we have the deepest sleep. Our blood pressure drops, and this is where the blood supply to muscles increases, our growth hormones are released, and what I like to say, our physical and mental energy is replenished. So REM, this is the rapid eye movement, and this is the stage of sleep where people principally dream. Our sleep cycles, again, they repeat over the course of sleep stages of 2 sleep stages of movement, and with and without eye movement. Now, when we're in REM sleep, our brain activity is identical to when we're awake. Our muscles are paralyzed except those that control our breathing, our heart rate, and our eye movement. And the largest REM segments occur later in the night or early in the morning, I guess. So that's why a lot of us, when we dream, we remember our dreams when we wake up early in the morning. And this REM is also where we create our long-term memories. And I'm going to get into this memory stuff in a little bit, but this is also what my professor called the REM stage, is the brain taking out the garbage. During the day, we accumulate a lot of garbage and our garbage can fills up, and at night, it has to empty. And if we don't empty it, we'll start hallucinating. And I'll talk to you a little bit about that briefly as well. So our bodies actually have, when we're talking sleep and mental health, our bodies actually have a circadian rhythm, which is about a 24-hour clock. And that's responsible for sleep function. Some people will have a 23, some people will have a 25-hour clock. But the thing about our circadian rhythm while this is happening is it prompts the release of some hormones. Melatonin is the first one, and that's called the sleepy hormone. And that hormone is released in response to darkness and tells the body it's time to prepare for sleep. Now, on the flip side, when it starts becoming light outside, the brain sends a signal to the body to release cortisol, and our bodies wake up. So cortisol is called the stress hormone, and that's where the levels are highest in the morning. And this is the one that helps us cope when we're under pressure, the stress hormone. However, chronic release of cortisol can lead to long-term mood disorders like anxiety and depression. And this is the one hormone that actually can impact our mental health, that has the biggest impact on our mental health. And eventually, if you get enough of this hormone being secreted or you don't sleep enough, you're going to feel fatigued. And that's one of the things we've been studying with some of our wildland firefighters is fatigue. So what do I mean by fatigue? That is, we're talking about fatigue caused by poor or inadequate sleep versus physical fatigue, which we get when we've been out working and had a hard, busy day. Now, the sleep fatigue or lack of sleep fatigue that we're talking about is known as cognitive fatigue. And that's the one that leads to reduced alertness, reaction time, and impaired decision-making on the job. We can have chronic fatigue and we can have acute fatigue. So rapid onset, long-term onset. So what does this research show us about fatigue? There's a lot of dangers to it. And there's been a lot of research on sleep and fatigue. And there's a lot of dangers. It's a safety issue because it creates a substantial cognitive impairment. It decreases our situational awareness. Anywhere from 7 to 14 days of constant fatigue or lack of sleep or less sleep than what we actually need. They're finding needs about 3 days of recovery with 8 hours a night of good sleep. Now, there's also been a lot of research done on fatigue and job performance. And research shows that occupational injuries are 61% higher when we work overtime. 12 days of overtime increases our hazard rate by 37%. 60-hour weeks, they've shown a 23% increase in work-related illness and injury. And so there's a lot of billions of dollars are being lost. There's a lot of research done on this as well. Billions of dollars are being lost in the workplace due to lack of productivity. There was a huge study done in 2016 looking at traffic accidents. And they found in that particular year that 100,000 automobile accidents were actually a result of, now these are the reported ones, not the ones that went unreported, were a result of fatigue driving or what we call sleepy driving. And with that, there were 1,357 fatalities and over 71,000 injuries. So fatigue, we're finding, and what I've actually found through a lot of my research and through studying up on sleep, I think sleep and a lot of our mental and physical illnesses or health issues are actually interrelated. Fatigue can cause health risks such as depression, alcoholism, drug abuse, and obesity, and so forth. So we're finding that a lot of these are, again, interrelated. So what about inadequate sleep? Sleep deprivation causes irritability. It causes cognitive impairment, memory lapses or losses. We call those micro lapses, impaired judgment, severe yawning. You can see all those there. Research has shown that less than 1 week of sleep curtailment in healthy young people is associated with changes in metabolic and endocrine function that leads to decreased carbohydrate tolerance. And I'll talk about that here in a little bit as well. One of our brain functions that buckles under even the slightest amount of sleep deprivation is concentration. We see that in the workplace. We see that on the workforce. When we lose sleep, when we go without sleep, even if we get a little bit of sleep, we get sleep debt that accumulates over the week. We find that our concentration is the one that's the greatest, has the greatest impairment. And then it also leads, as a consequence, leads to lower work production. Now, research has shown time and time again, this is the one I want to drive home. Chronic lack of sleep across the season predicts a massively higher risk of injury in athletes. And so I like to think of our wildland firefighters as tactical athletes. So we can put that into play with these. Chronic lack of sleep across the season predicts a massively higher risk of injury in athletes. Some of the physical functions that inadequate sleep causes, and research shows anything less than 8 hours of sleep increases our physical time to exhaustion by 10 to 30%. It decreases our aerobic output. So think about out there on the fire line. It also increases impairments as the other two previous speakers talked about impairments in cardiovascular, metabolic, and respiratory functions. So you can see there's a lot of physical functions. It promotes faster rates of lactic acid buildup. And lastly, it decreases the body's ability to sweat during physical exertion. So what about mental and physical functions? Again, I've kind of been going over these and I'll just keep reiterating because it's so important. Inadequate sleep causes decreased cognitive performance. How well do we do on our functions? It impairs our visual function. It decreases our reaction time. And as I mentioned earlier, research has shown that worker-related illnesses and injuries are much more prevalent. Now, a major consequence, as I mentioned earlier, of a lack of concentration due to sleep deprivation is in the form of drowsy driving. And Dr. Brian Walker down in California is one of the top sleep researchers in the world, and he's done conducted a lot of research on sleep and what it does to the body. So routinely, less than 6 hours of sleep, it affects our immune system. Again, this is all research, more than doubles our risk of cancer. It's a factor for Alzheimer's. Now, what they're starting to find is these all go hand in hand. I mentioned earlier, it increases that stress hormone, but it also makes the body, it makes us hungrier. It produces a hormone called ghrelin, and that can actually make us hungrier and decrease our carb tolerance. Again, as the others have said, it causes coronary artery blockage, cardiovascular disease, stroke, congestive heart failure, and so forth and so on. So we're actually seeing that they're finding through all this research that sleep, lack of sleep, is probably one of the contributing factors to a lot of our mental and physical health issues. So when sleep is limited to 4 to 5 hours a night, so after 5 to 7 days of sleep deprivation, alertness and performance decline to the same low levels as if you have not slept for 2 days. And the U.S. Army Research Lab has done a lot of research on sleep, and there's soldiers and military personnel going without sleep, and they found that 72 hours without sleep, their personnel become militarily ineffective. And one of the things that lack of sleep does is it mimics blood alcohol concentration. You can see the graph on the right there, graphic shows that 24 hours without sleep equals or mimics a blood alcohol concentration of 0.10. 21 hours without sleep is the same as 0.08 blood alcohol concentration. And that's the legal limit in all states. So if you've ever pulled an all-nighter and been driving, there's a lot of ramifications or things we can take home from this. So what about the role of sleep on performance? So sleep quality, again, sleep quantity is how much you sleep. Sleep quality is how well you sleep. And so we call that wake after sleep onset, WASO, W-A-S-O. And how many times you wake up after you fall asleep and how long you're awake. And that's some of the things we've been looking at in our research. But sleep quality predicts the gradual return of motor function. It also offers significant improvement to motor skill memory. It accelerates our physical recovery from common inflammations, especially when we work out or working out there on the fire line. We've had a long, hard day. Our body tissues become inflamed, and it stimulates muscle repair. It reduces muscle fatigue. I talked about that earlier. And it restores cellular energy in the form of glucose and glycogen that gets stored in our muscle cells. And it also gives us that benefit, the restoring benefit of perceived energy. We wake up feeling good. So other benefits of sleep, a lot of these, the same thing, services brain and body, prevents fatigue, enriches our ability to learn, memorize, and make decisions. So one of the take-home message I've learned from this, and I'm passing on to my students, don't pull all-nighters to study. You're better off to get sleep and not study, because you'll be able to think and make decisions better. Benefits of sleep, our psychological or mental health gets restored. It recalibrates our brain circuits, because when we're dreaming, our brain actually gets this consoling neurochemical bath. And so it restocks our immune system. They found it fights malignancies, prevents infection, and wards off sickness. So again, sleep goes hand in hand, I believe, with a lot of our mental and physical health issues that we're seeing today. And it also helps our metabolic state. So what are some BMPs? And I've been working with loggers. I've been studying loggers because they don't get much sleep. They'll drive 2 to 3 hours out on the job site, and they'll be up there at daylight, and daylight in Idaho, North Idaho at least, occurs around 4:30 in the morning. But so we call this sleep hygiene. I like to call it BMPs, or best management practices. The Center for Disease Control recommends 7 to 9 hours of sleep. We're all a little bit different. Some of us need 7. I personally need 8. Some need 9 each day in order to function at our highest level of effectiveness. Now that's mentally and physically. And as Dr. Walker said, in the context of injury, there is no better risk mitigating insurance policy than sleep. I just want to repeat that because it's so big. There is no better risk mitigating insurance policy than sleep when it comes to the context of injury. So what are some best management practices? Establish a routine. And this is the biggest one. If you can go to bed and wake up at the same time and not deviate from that, that is the best management practice you can utilize. Try to create a sleep conducive environment. Use your bedroom for sleep only. Choose and time your meals wisely, exercise regularly, be cognizant of alcohol and caffeine consumption. And I'll talk a little bit more about alcohol here in just a second, but we all know what caffeine can do for us. Some of us, it helps keep us awake at night. Limit your screen time before bed, especially on our phones and laptops that emit these blue lights. That sends a signal to our brain that it's not time to go to bed. And I know some people that I'm working with, they've actually got the glasses that block the blue light emitters. So anyway, get up if after 30 minutes you haven't fallen asleep, or if you have trouble falling asleep, try meditating, try music, any of your nighttime rituals that can help you. So I mentioned just a second ago, alcohol and caffeine. Well, I'm in the middle of BMPs, best management practices. I've had people in my talk say, well, what about sleeping pills? The thing about sleeping pills is they don't improve your sleep. They just create a sedative feeling during sleep onset. And so we need natural sleep for our memory connections. The thing about Ambien is it unwires our brain cell connections by 50%. In other words, it's a memory eraser. And those taking sleeping pills, some research, I didn't put the citation in here. Those that take sleeping pills are 4.6 times more likely to die. And this is all cause effects. Cancer is the risk of cancer is increased. If a person takes 132 sleeping pills in a year, they are 5.3 times more likely to die in the next 2.5 years. And again, this was a big study that was conducted where they were looking at folks taking sleeping pills. 18 pills per year makes you 3.6 times more likely to die from all cause effects, not just car wrecks, but from heart attacks and other things. Those who use sleeping pills are less likely to remember the previous day. And that also applies to alcohol as well. So alcohol is a class of drug called sedatives. And what it does is it binds to the receptors in the brain, preventing neurons from firing. It doesn't create natural sleep. But I've had people say, Randy, it makes me look more lively and social. Yeah, it does. The reason it does is because it sedates the prefrontal cortex of our brain. And that's where our impulse control area is. So a lot of people that have a nightcap at night, they can also get snacky. And so that leads to other problems as well. It begins to feel sluggish when our brain gets sedated. Again, it's not natural sleep. And the other thing that research shows behind this is that when we drink alcohol, the liver produces aldehydes and ketones. And the ketones, when they get produced in enough, from what I understand, they can actually wake the body up. And the thing about alcohol is it also prevents us from going into that rapid eye movement or the REM stage where we dream. And remember, I said our brain collects all this garbage during the day and it needs to dump it out. And if we don't get that, we're eventually going to lead to hallucinations, delusions, and disorientations. So one more mention about melatonin. Again, that's the hormone that's released by a gland. I got that misspelled there, a gland in our brain. And that helps regulate us, helps regulate our sleep and our circadian clock, our biological clock. Long winter nights, we get more melatonin produced. Short summer nights, especially like we see in Alaska, less melatonin is produced. And so I've seen some recommendations where you can supplement with melatonin for those phases. You can actually advance it, so to help you tell your brain to get to bed earlier. Just one precaution, that melatonin has been shown in some studies to constrict blood vessels, so it may pose a danger to those with cardiovascular disease. Okay, wrapping it up here. Finish off with BMPs on sleep. I went off on a little tangent there with sleeping pills, alcohol, and melatonin, but some of the other BMPs, if you're really suffering from sleep, you can go to a sleep therapist and look at cognitive behavioral therapy for insomnia. And one of the best things to do is reduce your caffeine, your alcohol, your screen technology time. Have a cool room. Your body, as it falls asleep, it cools itself off. If your body can't cool it off, we have a more difficult time sleeping. Again, the single most effective best management practice is to establish regular bedtime and wake up time, and go to bed when you're sleepy. Avoid couch dozing after work, and don't lie in bed. Get up and do something that's relaxing, and then try to reduce anxiety provoking thoughts and worries. Some other things you can do: remove visible clock faces. Clocks emit light. Restrict your time in bed. Stay awake longer. Build up. What you can do by staying awake longer is build up sleep pressure. And again, no exercise within 2 hours of sleeping, because that increases your body temperature, and it will also increase your metabolic rate. Try to get 1 hour of exposure to natural sunlight within a day. And one of the things, a hot bath can relax you. And then as your body warms up, as the temperature starts to drop, it'll start making you feel sleepy. Eating high carbs. This it's not been studied a lot, but there is some research out there that shows eating a high carb diet or high carb snacks right before bed can lead to less deep sleep and more awakenings. Again, try to avoid being too full or too hungry. And so as we wrap this up, your body needs sleep, period. Time and time again, research has proven that people who think 6 hours is all they need, they end up getting into car accidents, they'll make mistakes, and are not able to exercise to the degree they want to. And so I want to end with a quote that I've started using, especially with the loggers, is we routinely service our equipment. Let's practice servicing, pulling maintenance on our most important piece of equipment, and that's our bodies and our minds. So, okay, thank you for this opportunity to share with you today.
Thank you, Randy. That was excellent. If you could please check the Q&A box and see if there are any questions in there you can answer. And then will you be with us during the panel at 1:15 Mountain Time?
Yes, I'll stay on.
Okay, thank you so much. Given that this is about health, I'm not going to cut into our break. So let's take 5 minutes and be back here at 12:28 to hear another really wonderful talk by Joe Soul about physiological health and job demands. See you in 5. Okay. Joe, are you ready? Five minutes goes by quickly, I know. Hi, Joe. So I think your talk will follow great after Randy's talk on sleep. For those who don't know Joe, he's an exercise physiologist with the National Technology and Development Program out of the USDA Forest Service, and he'll be talking about wildland firefighter physiological health and job demands.
Is that better? Can you hear me now? All right, perfect. There, we're in place. All right. Okay. So with that, just a quick introduction. My name is Joe Saul, and I'm with the National Technology and Development Program out of Missoula, Montana. We're in the engineering branch, and in the past, we've done a few collaborations with some universities and whatnot. Full disclosure about affiliations, I am currently a student at the University of Montana, looking at cardiovascular health and wildland firefighters as it relates to smoke exposure and sleep and careers in the Forest Service. So we have that affiliation there with U of M, as well as the Montana Work Physiology and Exercise Metabolism lab. So with that, just kind of going into what I want to cover for today. Just as we see here with this 3-day webinar, this is a complex environment with this occupation. And I think it's really important, especially for me, just to hone down into what my specialty is here and just looking at the human input. And we're looking at aerobic fitness level and how that correlates, as well as food intake and the job demands and how that plays into our human input and ultimately just successful physical performance. To do that, I just have 3 papers I want to cover today. The first one looking at the seasonal changes in wildland firefighter fitness and body composition across the season, and then looking at food intake, where we actually monitor food intake and energy expenditure on firefighters on large assignments, and then honing in down to metabolic demand of hiking paper that we did. So with that beginning here, we have aerobic fitness levels across the fire season. So in this study here, we went and we looked at 4 crews. Sorry, I'm moving things around on my screen. We had 4 hotshot crews and 1 type 2 crew, totaling for about 65 individuals. And in doing this, we went through and did preseason and postseason testing with these individuals to look at aerobic fitness levels. So this column here on the left, if going through and look, is a maximal treadmill test for aerobic fitness. What this test looks like is they just run on the treadmill and we keep turning up the speed until they can't stay on anymore and fall off. But in doing so, we get to see their peak aerobic fitness level. And then we also look at a sustainable aerobic fitness level. So here on this left column, we have the 3 hotshot crews here, here, and here. And what we can see is there's really a broad range of fitness levels coming in the door at this preseason time point. For this crew here, we can say that the typical average American college male is usually about 45 for just kind of a scale of reference. And then these 3 hotshot crews tend to be above that as far as above the general population fitness levels. We do have here on the lower part of the screen, we just have 1 type 2 crew. So it's kind of underpowered, but we do see kind of slightly lower peak aerobic fitness levels in this crew. So in gathering this data, we wanted to go through and make sure that we can start getting reference material for training programs, especially for these individuals. It's important to note here that there's a huge demand on PT leaders for crews when they have this wide range of fitness levels coming in the door and really no objective in what the optimal fitness level is. We do see, though, in looking at a postseason time point, really they stay about the same going across as the average. Some individuals did improve in peak aerobic fitness and others did decrease, but all in all, they stayed about the same in this one measure. If we move to the right side of the graph here, we have what's a ventilatory threshold. And best way to describe this is just the point at which you can go from doing the intensity all day long to when you can only do it for a few minutes. So kind of that switch. Sometimes this can be associated with a lactate threshold or just kind of that switch to anaerobic, but it's really just when that individual has to shift a gear essentially. And then we see a result there. But a good way for occupational fitness is to look at the sustainable fitness level to see what somebody can do. And a good way to describe this is this one can go about 50 miles an hour and still be in first gear, while as this individual here can only go 30 miles an hour. So in theory, a higher level of sustainable fitness can lead to a higher work output capacity in one regard. What we saw with this study here is we have, again, a wide range, but we also have kind of this funnel or cone pattern, which is really interesting. But when you think about it, we're going through and looking at a 4 or 5 month fire season, sometimes longer. And all these individuals are coming in and doing the same PT program, doing the same job out on the fire line. And so it essentially equates to a 12 to 16 week marathon training program that they're all doing together. And so and with it being a crew activity, a lot of times they just hone in on that same fitness level. So we saw that trend with all 4 crews narrowing into kind of almost what we could look as a target fitness level for sustainable. It's roughly the same between the 3 hotshot crews, and then again, just slightly lower for the type 2 crew. What's interesting here is we went through and we were able to do a mid time point on these 2 crews. And what we saw is really these changes all happened in the first half of the season. So that's just something we want to hone in and seeing if we have all that adaptation in the first 6 to 8 weeks, what can we attribute this to? Is it good? Is it bad? Is the thing go from there? So what we wanted to do was kind of hone in on the first 2 weeks of that first 6 or 8 weeks of the season. But before I switch gears here, I want to just hit a few more highlights of the study that we saw here. The big thing was the changes in body composition. The changes in body composition, we saw no differences between gender. We did see variation in changes across the season. That first half was the primary work, and most of these individuals lost about 2 to 7 pounds of body mass, 1 to 3% body fat percentage, and really those losses were primarily fat mass. There was a maintenance of the fat-free mass, seeing that range from -2. So if someone gained 2 pounds to going through and lost 3.5. So what we saw there was out of these 65 individuals, kind of a general decrease in targeted fat mass, essentially. One more thing just to point out here again is we want to go through and look at this kind of ideal target level, but at the same time, sorry, misspoke there. What we want to identify here and switching to this next slide is seeing if these individuals that are coming in above fitness level, if that's actually truly a better situation than the individuals that are coming in a lower fitness level. You can pretty easy to argue that early on, but at the same time, you can also say that these individuals were able to see positive gains. So it wasn't a situation where they were overtrained or anything like that. So the fact that we didn't have anybody in the study have a decrease when they were below the level show that there was a successful training program in some way, shape, or form. So with this next step here, just switching to the first 2 weeks of training. Here, 1 sec. Have my stopwatch going. We looked at just the critical training study. And so we did this study with the Lolo Hotshots in 2019, and then we're actually completing this study now. It's actually why I'm in an airport right now. I'm flying down to California to do data collection here later this week. But we're looking to do this study with 3 crews, 1 in Montana, 1 in Arizona, and 1 in California. And we'll be done after this week. But we have 2 published papers on this first study with just the 1 crew. And we really did seek to define that fitness improves the ability to handle the stressors of the training. In doing this, we actually got the answers of, we saw decreased muscle damage, muscle soreness, and overreaching. And then we also saw decreased cortisol levels, a measure that Randy was just talking about here in the previous talk after 5 days of prescribed burns. And we can really see the narrative of this critical training in those 2 weeks where we saw muscle soreness increase after the first day of kind of a saw appreciation hike. The individuals were able to recover over 5 days of a burn. And then again, when we had them do the BLM fitness challenge, we saw an increase in upper body muscle soreness. Gotta love those pull-ups. But it really goes through, we're just, again, defining the picture a little bit, painting the picture better, and looking at CT is expected to be difficult, but we want to look at specific trigger points if we can to see how much is too much and how can we build these individuals up. So just recapping this, this first tier of the study, looking at the importance of sustainable fitness, effectiveness of crews may be limited by the least physically fit crew members, and that body mass is lost in the first half of the season, which primarily being body fat, while we still see a maintenance of muscle mass. In that regard, talking about this fat loss and that across the season, I kind of want to switch gears into nutrition a little bit. This study here looked at the total energy intake on a large incident. In doing so, we had the fun opportunity of taking a plate out of the chow line and weighing it on a food scale, and then following firefighters and hovering over their shoulder and watching everything they ate. And if they left anything on the plate, we would steal it from them and weigh that so we could look down to the gram of what they ate for scrambled eggs, sausage, everything in between, every meal on the fire. In doing this, we were able to go through and look at the calorie breakdown throughout the shift, and looking and see how we roughly get about 1,000 calories at breakfast, 1,500 during that work shift through the sack lunch, a little bit higher than 1,000 at dinner, looking at dinner and salad bar, with a total estimated daily intake about 3,600, ranging from 3 to 55, somewhere in there. But we also saw the carbohydrate breakdown, fat, protein, and then also looking at sodium and potassium intake throughout the shift. In regards to this, we do in this occupation have a higher water turnover and kind of associated electrolyte needs. And that was one of the questions we were looking at with this, is to look at how much sodium, potassium we get throughout the shift, look at an estimated daily loss, but then also seek to verify. So in doing this, on this next study, I'll actually hop here. We went through and we actually did blood draws pre and post shift. And then also another highlight of my research opportunities, we had firefighters pee in an Nalgene bottle throughout the whole time they're on the fire assignment. So in doing so, we could look at the number of voids, how much volume they produce as far as urine, but then also test that as hydration indicators. And then stacked with the blood draws pre and post shift, we could see if we actually did see issues with blood glucose, serum sodium, serum potassium, and serum chloride across the work shift. In doing so, we saw a maintenance of these values. If we go through and look at how much intake that we saw during the shift, a big component is always going to be how much food is actually consumed. Food qualities will always be a topic. But if we are looking at what is coming out and what is available, if those food items are consumed, we see a maintenance of these values across the shift and staying in clinical normal values. So indicating less of a need for some of those items if we are eating the food items provided. Having said that, the food contract is a very political topic, and really these last couple of years have kind of shown to me that it's really a three-pronged approach. We can have this food contract or a food specification looking to get these specific macronutrients and food items to the individuals, but then there's also a contracting component to that, which is a very large component. And then there's also the actual food delivery, both to the incident, but then also the food supplier, if you're looking at like food services in America and what we can actually choose from. And I think these last 2 years have really stressed that system quite a bit. What we can leverage off of this is seeing that we do have the potential for going through and providing some quality food options. We can always improve the quality for sure, but as far as quantity, we are hitting the mark. So we have that target established, and now we can tweak to try and appease the masses in a lot of ways. But so just hopping back in one regard here, in this food study that we did here, we can see that we typically had a 14-hour work shift. for these individuals. One thing we did with this is we actually associated calorie intake and work production on the fire line. And what we saw is most individuals do the highest amount of activity in the first 3 hours of the shift. That's typically that ingress hike into the fire line. And what we saw is once we normalize how much they eat compared to their body weight, we can see people that eat kind of a normal amount of food for their body weight, or they're kind of lower, or if they're eating excess calories for the day. We actually saw increased activity throughout the work shift if individuals were eating more. So going into kind of a recap on that study, I did provide it on the agenda, on the website and the agenda as well, if anybody wants to read the specifics of that study. But we have here insufficient feeding practices were observed. Really what we saw is people are burning more calories than they're eating, which goes into, hey, we need to have better dietary choices in those food contacts. We can go through and write an ideal spec, but if they're not being eaten, they're not given the nutrient needs to the individuals. Also, along with this, we did see an association with energy intake and work activity, that if you were eating more relative to your body weight, we saw increased activity counts. And then also we saw that more feeding episodes equals more calorie consumption. That was probably not the most glamorous finding of this, but the key interpretation of this is going through and looking at how many eating episodes we typically see through a shift and how many calories are typically in that episode. How much do people want to eat throughout the day? Another thing we saw too was there was no relationship with feeding frequency and work output. So by telling them to take more snack breaks, it did not affect their work production throughout the shift. There's one thing to note here. So if we can hopefully increase food items that are more desirable to eat and have more feeding episodes, we can start to close that gap between the energy expenditure and the energy intake that we're seeing out on large assignments. And then going into the last component of this 3-tier presentation here is just going into a specific task. What we've seen with some of our field research studies is about 50% of the time is spent doing non-physical tasks. The other half of the shift is doing physical tasks. When you put an activity monitor on someone, it just looks like they're doing sedentary activity. And I don't like that terminology, because those sedentary activities are typically driving, briefing, tactile pauses, things that are necessary and have a mental demand to them. So when looking at physical tasks, we do have our most common physical task is hiking. In this paper here, what we looked at is we identified those hikes into an ingress, kind of a shift hike, an egress, and then our training hikes. So the ingress hike is the hike into the work unit for the morning. That's our most common hike that we do, and it's typically our hardest hike that we do, and probably the hardest activity we do on a daily basis. What we can see with that is that hikes usually occurring 2 to 4 hours into the shift. It ranges from about 10 minutes to 90 minutes, but the average is about 20 minutes duration. And then we have defined metrics now at really what that hike is and what we can start trying to utilize in the future as far as work capacity testing, and seeing that hikes that actually occur out on the fire line are 1.8 miles per hour at 4% grade with that. So one of the key findings of the study is we were actually able to have the field monitoring and to define what those specific hikes are. And with that, we can look to leverage that and inform any work capacity tests that we choose, any revisions that we may choose in the future. Along those lines, we can see here too, this graph here, the graph here on the last slide actually has error bars. But what we can see with these hikes is the training hikes are the hardest hikes that we do. And if we had an error bar here, this isn't the right y-axis to show that. But our training hikes typically represent the hardest hikes that we'd ever see out on a fire line. But just looking at if we're doing those training hikes 2, 3, 4 times a week, that's really training at intensity above what we actually need for the job. And so we just want to start looking at the goal of any training program. We want to be able to hit that high intensity for sure, but we also want to look at maintenance of our workforce and looking at where we want to spend our time as far as low intensity and high intensity tasks to build up long-term aerobic health. Some of the key things we also saw with this is to define this graph here. It's the amount of time spent above that ventilatory threshold, percentage of time on these hikes. percentage of time spent above the intensity of the pack test. And then here is the percentage of time with the core temperature at a value that's loosely associated with risk for heat stress. So we did see here that our training hikes are putting us there at that level, but in a lot of ways you can argue that that's a good environment to get individuals warm. If you can have them go do a 2-hour warm hike and then go back and cool off in a cool environment so that we can see some heat acclimation and whatnot. In that regard, that being a good stress is possible there. One of the things we saw with this study here too is just the effect of load carriage. Total equipment weights are different than pack weights. Pack weights we can typically see about 35 to 50 pounds, but once we start putting boots and tools and things like that, we can quickly approach 24 to 50% of body weight. So in that regard, and it's even a little slightly higher with females, looking at 1/4 to 43% of their body weight. When we start looking at a pack breakdown and things like that, we can see that the pack itself is much closer to 25% of body weight for both IHCs and engine crew. But then also looking at, we're carrying a lot of water, and then just looking at supplies and food breakdown in those packs. If you look at some of the military research labs and some of their energy cost and efficiency studies, a common threshold identified in prior studies is 25% of body weight. So similar to what Randy mentioned in his best management practice, is we definitely want to be shooting for that with an overall total equipment weight if we can. And in a lot of ways that means trimming that pack down into the 30s. So really here is a summary slide going through and looking at, we define the typical hikes for job performance metrics. That ingress hike is the most consistent, and we can use that as a kind of a threshold in a lot of our PT training programs because of the established demand there and the fact that we've kind of defined some of those parameters. One of the things that we can go is even going back to that first study. This here is our preseason ventilatory threshold. We can see here that we have also the pack test, the intensity of our training hikes, looking at just aerobic intensity here on the y-axis, our ingress hikes here. So interesting note is what we saw as the work capacity test 30 years later still predicts probably our most common hiking that occurs out on the fire line. With that though, we can see though with hand tool work, chainsaw work, urgent hand tool work, and some harder hiking, we do have moments where we need to exceed the level of that pack test. But on an average, it almost worked out perfectly as far as how that measured out. And finally, here we did see with a prior study with the simulated escape route on the Man Gulch fire, kind of the highest level possible of some of our kind of a sprint hike in that fatality simulation fire through there for reference. So again, some of our training hikes and then just an absolute sprint. But what we can see there is those training hikes were kind of trying to maintain that ventilatory threshold and a variety of different intensities across the season, keep our postseason ventilatory threshold at pretty much the same level. So with that, that was a very quick overview of 3 papers. But I can sit here and answer a few questions for a moment and then go from there. Did you have anything, Vita?
No, that was great. It was a lot of information. After sitting through all of these talks, I'm glad to know they'll be recorded so we could go back and pick up more details. There is one question for you in the Q&A box, but I'd like to keep us rolling with our next speaker. So if you don't mind either answering that in the Q&A or during the panel, Joe, that would be.
Sorry, I had having some interesting audio issues. I saw on here if I should have spoke up a little bit more, but I'm not getting any audio from anybody right now.
Can someone reply to him in the chat, please? And I'll introduce our next speaker. Okay, so our next speaker will be Luis Gomez, and he's Assistant Forest Fire Management Officer on the Mendocino National Forest. He's also chair of the Region 5 Human Performance Committee. And Luis, in addition to presenting the science today, we really wanted to present some examples of how this science can be applied. So I'm appreciative that you're willing to come on and tell us how you're doing that there in Region 5.
Okay, thanks for having me. Again, Luis Gomez from off the Mendocino National Forest, Assistant Forest Fire Management Officer. Started, down this journey. I've started fire 30 plus years ago on the Sierra, and then moved my way around, jumped and hot-shotted. But I also have a degree in physical education with an emphasis in athletic training. Just so people know, this is a bigger effort. And I want to share some names. Mike Minton, National Park Service Regional Chief now. Merv George, both of those two gave us direction and where to move with support of this program. Josh Icamer, who's the FMO on the Six Rivers Redwood National Park. Adam Coronado, who's a master's of kinesiology from Fresno State, as a Mendocino hotshot captain. Ben Strawn, El Dorado hotshot superintendent, has been helping out. Jessica Martin, a dispatcher out of Salmon Chalice Region 4, has been a huge help as well. Nancy Romero off the Cleveland National Forest. Mike Knoll, Region 5 Fire Risk and Management. Matt Holmstrom, Region 6 Fire and Aviation Risk Management. And then the 6 Northern Forests that provided funding. Modoc, Lassen, Shasta Trinity, Klamath, Six Rivers, and Mendocino. A couple of other people that helped out, Kyle Betty. And then from Cal Poly Humboldt, we had Jill Pohowski, Taylor Beloden, Brian Blackburn, and Chris Hopper. They're all the doctorates. And Lucas Kopinen is a student working, just finished his master's as well. And then contractors we've worked with are Corey Jung from Upright Movement and Mike Contreras from Functional Movement Systems. So just wanted to talk about those things, those folks that have helped out in a lot of ways. 3 things I want to ask. And these are questions I'll answer throughout my presentation. One is, what makes you qualified to lead your module or other people in your agency in physical fitness? Why can't we rename physical fitness to injury prevention? And are injuries, health, and wellness an agency issue? So with that, I'm going to get into, I have briefing papers that I have in front of me. I provided them to the panel to hand off and share as needed. So let me get into the one I'm trying to find here. So one of the things we start off with is we start into this introductory to principles of techniques and physical fitness and development. We tried to do a class at Cal Poly Humboldt one year. Adam Coronado, who had just finished he hadn't just finished it. He had been teaching at Fresno State for about 5 years, came in with the syllabus, and we transitioned that syllabus into a 80-hour or 40-hour class, but it was a semester-long class. And so presently, there's no professional level qualification in our agencies, in all the agencies, that says, hey, I'm qualified to run a PT program or injury prevention program. And so this class leads you from the idea that you would do a pre-test and understand where people are, and then how to implement the workout from the individual to progression to rest, recovery, and then, the stress, how much stress you're going to place on them so that they can get better at it. So that's the idea of the class. It's really to teach the individual how to build themselves a workout plan. And so with learning how to build a workout plan for yourself, and then seeing, the time course for adaptations, how that occurs, then you could then transition that to running a crew or a module, or running a program for your own module, is how we're seeing this. We have provided these courses in Region 6 and Region 3 to help them get going on providing these courses in those regions. In Region 5, we've done 5 of these courses, 5 or 6. And then we've been trying to really coordinate those more towards the level of a forest, one single forest, where like a whole module could show up and take the class. So that's one of the classes that we're doing, that we're providing in the region. Another area that we are working on is wellness leadership, and it's a 15-unit certificate program out of Cal Poly Humboldt. Again, this is that week that we were in Cal Poly teaching, and each of the development of these courses, the professor of that department came and sat with the Forest Service employees, and in this, they built a curriculum of this wellness leadership certificate program. And these courses are, they're being taught by the professors, being taught by the doctorates, which is really, in our mind, that's the scientific based training that we need to get people to maybe change habits or behaviors. So that there's the introductory to wellness leadership, which is a wellness course itself, which is evaluating your personal habits, your sleep, your diet, your workouts, all those things that you need to really evaluate. And then you move on to the next course, which would be the college version of introductory principles and techniques for physical fitness development. So that there is the university. They're going to teach a little bit different than the way Adam does, or whoever we can get to up to that level to teach the course. And then there's an ergonomics and injury prevention class and a nutrition class. And then it's followed up by an advanced physical training applications, and then a capstone. In the future, the way this was directed and guided is that this course was set the way it was. But when Merv George and Mike Minton gave us direction to move forward, that these classes, this idea of all this stuff was to be for agency personnel, not just for a FAM or it's for everybody. So in the next iteration of this wellness leadership, there's going to be a second offering. If a person doesn't want to take the advanced physical training, they can take a longevity in the workforce course. We don't really know what it's named, but we're going to have something like that where they can actually come up and build workout plans for longer sustained lifestyle in our program. So that's where we're working at with those. Another area we've been working with, and this is where Mike Contreras comes in, and Corey Jung out of Arcata. He has upright movement out of Arcata, and he introduced the Six Rivers folks to functional movement systems. And I think if you look into this, it is an injury prevention tool. It has 8 simple things you would do. You would test people on, and in those tests, you put in numbers, and you put them into a computer algorithm, and it pops out exercises and weaknesses where you need to work on. And this may be stretching for 10 minutes. It may be lightweight band workouts for 15 minutes to improve your potential, to improve your the way you're not going to get injured. So this is so we were offering these courses to what they call level A, which is a student trainer, and that's where they would learn how to do the assessments, the eight assessments. And this gives you a kit and gives you all the how to do all the stuff, and gives you the coaching on how to do that. Level B, and it's a combination course. There's some self-paced virtual stuff, but then we did some time with Mike Contreras and his staff in McClellan, and it was one of those ones where I went in, I wasn't sure what Mike was going to produce for us, but I'll tell you what, the examples of the training and the exercises that we could do to strengthen people's lower backs, because if you look at it, our injuries are and hot shots and engine folks is generally lower back and shoulders. So the workouts that they were producing and showing us, and then of course they are going over back. They're going back over the 8 movements to show you how to do the test again, and then they're showing you the exercises, the corrective exercises to prevent injuries. So pretty amazing class. And then a level C, which is a instructor trainer. Again, this is another, a little bit more hands-on, more training, more preventative maintenance stuff, how to do that, how to provide that for employees and do the test. So functional movement systems, it's a great tool, injury prevention tool. And I think that we should, I think if you can incorporate that into your day, get a test done, incorporate that into your day for a month or two while you're getting ready for season or even in season, and then understanding where you work on. Another area that we worked on was the Whoop bands. We did some research on this. Again, just like functional movement systems, FMS wasn't just that's who we're going to go with. We had a few conversations with several companies to find out what would be best and best cost and function. FMS was the best and provided a lot of training for us. Another area that we looked into was a biofeedback device, and which was Whoop band. We ended up with Whoop band. We had interviewed, I think, 3 other companies on what they were producing and what we would get out of them. And Whoop does provide us quite a bit of information, whether it be your stress level, your sleep, all those things are the important things you can get off of Whoop band. One of the things that we did find, just like Randy and Joe have talked about, was your sleep. We're not doing so good in sleep, and that's pretty much what the Whoop band told us. But it also makes it also provides the individual with a way to self-stewardship, to recognize when they need to do this, when they need to go to sleep, like what was brought up in the previous conversation. So for instance, like Kyle Betty, when he said he was wearing his, he realized that doing the evening session of dozing off and doing your neck workout, that wasn't good, and just going to bed was the better idea. And it was drastic in his sleep recovery, because those things are all important. All these things are important together as a group. They cover the wellness, they cover the risks. So going back to my questions, these are all tools that we can use throughout all the agencies, all the land management agencies, even regular fire departments, or even in agencies that have people that are out working in the woods or out working on roads or whatever. Just these small things could help out. And I think if we were to look at more adoption of these, you're going to reduce injuries. Does a geologist, does an anthropologist, does a botanist, archaeologist, do they all work in the woods and walk in the woods, and do they need to move right? So yeah, we all do that. Somebody may be digging, but we need to understand that with these programs, we can change. It's a cultural change, what we're trying to instill with the introductory to principles of physical fitness is, coming in with a plan to test people, build a program, and then test again in a month. And that shows you what works and what doesn't. And, those things are important. So, and understanding what we need to do, as Joel said, here we're doing these extensive hikes, and we're not doing what we need to do to really, if you're doing that every day, you're setting yourself up for injury. We have a tolerance for stress adaptation, which, you can stress the body so much, what the ultimate outcome is going to be is negative, or you don't stress it enough and you're going to put somebody in a working environment that's really extreme, and you're going to have the same result. But if in there you train the way you need to, you hit that goal, you hit that that nice sweet spot of training for the individual, you will reduce those injuries, and that will be ankles, backs, everything. But we also need to understand that that training is really important, how we produce it. As Brian Blackburn who teaches the advanced and intro to PT for the Cal Poly he says you need to turn it all on, because this job is so different from everybody else, that you need to learn how to turn it all on, because when you're digging line, you're not just using your arms, you're also using your core, you're using your back, you're using your lower legs. And then you turn around and you hike or you do other things, excuse me. But those are the things that in Region 5 that we've been working on. Like I said, I've provided the briefing papers to the panel, and if people want them, we can make them available. But, a lot of this is stemming from, we did have injuries. We have had injuries. We're going to continue to have injuries. But I think we can reduce our injury rate in PT and on the job if we start educating people how to best produce the training. Because generally what are we doing? We're picking the Adonis or the whoever that is to lead the training, and that's not our best option. It's the most educated person on how to do it correctly. So that's where we're headed with our program and what we've been operating under. And I can leave it there, and we can, I guess, Vita, if you want to take it away, or if there's something else you want me to discuss that I might have missed.
No, that's great. Thank you so much, Luis. So one of the questions we have is this self-development fitness program or course available for sharing and coaching for us BLM folk?
Yeah, we are trying to get this across the DOI. That's why Mike Minton is from the Park Service has grabbed a hold of it. He did help us get this started, and the idea with the wellness leadership course is that any university could take that program, that 15 units, and move it to another university. The way Josh set it up in the agreement is we own the content for the wellness leadership. And so that university, whether it be Boise State, Oregon State, UNR, I don't know, they could take it and provide that content as well, is how we see it. So that was the idea of the way we had that built out, if that makes sense.
No, that's good. Autumn, I would like to invite the person who asked that question. It looks like it was Wendy. Wendy, do you want to unmute? You could raise your hand. I just want to, because this was the point of Luis's presentation. And so I just wanted to see if you had any follow-up, or did he answer that as well as you need right now, Wendy?
Hi. Hey, Luis. Nice to see you again. I think so. It sounds like the ownership of the course is owned by the interagency partners. Is that correct?
Right now it's by the Forest Service, but we are working on an agreement with DOI there's a briefing paper out there being socialized for it to go through multi-agency.
Okay, thank you. That was really about it. Thanks.
Excellent. And then you had a question too about to what extent you're finding that wildland firefighter retention issue is tied to physical and mental fitness, compared to all the other reasons that affect retention.
I don't know the outcome. I know at the jump base when I was there, we started to see more failures in the recent years. But I have a feeling, I don't know how to do this softly or the right way, but our inability to start making that contact once the person gets a job offer and say, hey, in a month, you need to be prepared to do this pack test and then do these other things. So I think that is part of the retention issue is our communication of what the job really entails, because it's not, it's not an easy job, weathering on an engine and tomorrow you're going to roll out 5,000 feet of hose on a fire, or you're going to hike up a hill as a hotshot crew, or IA as a jumper or heli-tac person. It's a tough job.
Okay, I think we'll call it there for you, Luis, and then move into the panel. Thank you so much for taking time to share those examples with us.
Yep.
So Autumn, I would invite you to switch it to gallery view where we can see our panelists.
All set.
Okay, and just a question for you. I know Joe Soul got kicked off. He and I have been communicating a little bit on the side. Has he been able to join back on, or is he still kicked off? He's still off. Okay. All right. So I don't see the same view, I don't think, as the attendees. Would one of the attendees please let me know if you can see the gallery view of all the panelists? Okay. Janie says I see 3 people. So who do we have? Do we have Randy and Luis and Alicia? Kat, are you with us? Would you be able to turn on your video?
Yeah, they'll only see the people who have videos turned on. And Vita, I changed yours as well for the panelists, so we are all now in gallery view, attendees and panelists both.
Okay. All right, but it's just the people who are speaking and the panelists that have their video on.
Yes, I believe.
Right.
So. Yeah, just the panelists who are people who are labeled as panelists for this are showing.
Okay. Well, thank you so much to you, especially to you early speakers, for hanging on to join us for these Q&A. And I know that a lot of the Q&A have been answered in the Q&A box, but I'm not sure that all of our attendees have been able to track that. So I'll kind of bounce around a little bit, but Kat, I'd like to start with you because there was a question that you said you'd like to talk more about during the panel. And the question was the focus, it was by anonymous attendee. The focus so far has been on wildland firefighters with some mention of prescribed firefighters. Has similar work been completed on prescribed firefighters? And if so, how do their results compare, particularly with the need to often be on the holding line in close proximity to exposure to smoke during ignitions and mop up?
Yeah, so I bounced around a little bit on the exposure studies, and I definitely use the term wildland firefighter interchangeably for folks, working on wildland and prescribed fire. So, but to also point out that actually a lot of the exposure work that's been done, as well as the health effects, have been done on firefighters performing prescribed fire. And the main reason for that is, as a researcher, it's a lot easier to get access to those types of events, as well as the fire personnel who are working, since it's not quite the emergency situation. So we have past studies have reported, when you aggregate them all together, we do see higher exposures for folks working on prescribed fires than wildfires. And I think, like the question alluded to, the holding as well as mop up are very big tasks as well. And a previous study as well found that firefighters performing firing had higher inflammatory markers in their bodies, and they kind of hypothesized that it was not only due to the exposure to smoke, but also due to the fact that they were being exposed to the combustion byproducts of the torches as well. And so when looking at, like, kind of putting all the exposure studies together, something I didn't quite mention and talk about is, it's really difficult work to do, obviously, because you have to go out there and use a lot of equipment that was not necessarily designed to work in the wildfire environment. But also, when trying to characterize this as an occupational exposure, it's really hard because we have to think about all of the different types of days and conditions that we see. So capturing that exposure variability is something that myself, as an exposure scientist, I've really struggled with, and really trying to think about, how do we capture all the days in between the indirect line prep where you have clear skies versus, the days that you're holding and you can barely see 10 feet in front of you. So that's really what we're trying to capture more of, but it's just really difficult work to do.
Thank you. I'm going to switch over to Randy now. And Randy, I know you just answered this in the box, but I'd like to ask you aloud. We know that firefighters are often required to do long shifts, 18 plus hours, and get much less than 5 hours of sleep. What would the recommended recovery look like?
So we've shown in some of our unpublished research that, excuse me, it's age dependent. I don't mean that to sound like a cop out, but the guys and gals that are in their 20s. So we've been using actigraphy bands from fatigue science fatigue science ready bands. And we found that so what we do is this gives us a score of 0 to 100. And I relate it to like grades in school because I teach over here at the U of I. And anything above 90, you're getting an A. And 80 to 89 is a B, and so forth and so on. So we find that a lot of the times our wildland firefighters will dip down into, we've had them as low as in the 30s when they were working up in Alaska, which means they are significantly fatigued. Their reaction times are way low, and the younger they are. Well, to make a long story short, right now, from our first year, we've found that the 2 days off after 14 days is getting them back above 90 in their alertness scores. And that's the thing that's important is their alertness scores. But what we show is over this progressing over the season, over 4 to 5 to 6, however long they're on fire, is that they're not recovering back above 90. So let's say your first roll, you go out and you're at an 80, you drop into the 70s, a couple days off, and a couple days off with a couple of good nights of quality sleep, not necessarily quantity. And so we've been able to measure that as well as quantity versus quality. A couple of good quality nights will get you back up into the 90s. It may get you to 95. Then the next time around you come back, you hit 92. And then the next time you come back. And so what we find is over the season, they've significantly declined in their alertness scores. There was another point I wanted to hit on. Again, one of the things we're finding when we interview these folks is they say, especially the firefighters with children, we found that when they go back, their wake after sleep onset, the latency and those things, they're not sleeping as good at home and so when we interviewed them, they're like, well, when I go home, I get, not for this to sound this way, but they say the wife says, here's the kids, I've been with them, now they're yours. So we're not getting as good a sleep at home either. So I don't know if that answered the question or not, but so this thing called sleep debt also, if you need 7 hours of sleep a night and you're only getting 5, then you've accumulated 2 hours of sleep debt. And across a week, then all of a sudden you're at 14 hours of sleep debt, and you can make up for that. And the sleep specialist I'm working with works with Olympic athletes, and she recommends one of her BMPs is cat nap every chance you can get, which when I'm working with wildland firefighters, you can't, that's hard to do. So one of the things I meant to say is my takeaway is be cognizant of the fact, and I do this with loggers as well, because they're the ones, loggers and wildland firefighters have logs, things falling around them all the time. Just be cognizant of the fact that you are fatigued and your reaction time is slowed. So it's just creating a mental awareness kind of thing.
Thank you. Okay. So I'm just going to keep on moving to make sure we hit each of our presenters. So Alesia, you went ahead and answered your questions in the Q&A box, which we appreciate. I was just wondering if any of them stood out to you or if you had any lingering thoughts after reading those questions that you'd like to share.
Yeah, so sorry, I had a location change.
But something that did stand out to me is that a lot of the questions I asked or I answered hit on some of the things that I've been thinking about a lot recently, which is the fact that while what we know so far is valuable in that it's novel and it gives us something to build on, we do lack a lot of clarity on some of the further classifications we use when we talk about firefighters and wildland firefighters and their responsibilities. So we need to combine better exposure data, whether it's like survey data or it's biomarker data, with what we've collected regarding pregnancy history, because pregnancy history itself is rather long and extensive. You know, what we had to do with the surveys was ask women to recall their entire pregnancy history, and it's like, okay, for the first time, what happened, second, third. So something that'd be really great to work on is some kind of like perspective cohort or a pregnancy cohort where we can follow women who are either, you know, earlier in their pregnancy or they're planning a pregnancy, to really get at, you know, what they're experiencing, what they're being exposed to in the weeks and months leading up to their pregnancy or even during their pregnancy. I think that'll provide like a lot of valuable evidence, especially to inform departmental guidelines and policies, which is something I get emailed about quite a lot. People want advice, people want evidence that they can take to their chiefs, their administrative levels, to really enact some kind of change. But at the moment, you know, there isn't really anything that's strongly suggestive of anything at the moment, which is a lot of what research is kind of like small incremental steps until we have enough evidence that we can kind of summarize it into a broader, stronger statement. And at the moment, we're really building on what we know, but there's still so much more we can do.
Thank you. There's always the next research question, which is great. So I'm going to go ahead and move on to Josel, even though he's not on with us. There was a question for him that I was able to get him to answer online. And so the question was regarding macronutrient breakdown. Any concerns long-term or short-term for consuming that many carbohydrates? So I'm going to go ahead and read that. I haven't had a chance to copy and paste it into the box, so I apologize for that. But basically what he said is carbohydrates are good, efficient energy for endurance athletes. Short-term nutrition leads toward just making sure you get the calories you need to refuel. Timing of carbs before and after to refuel and refuel activity is beneficial to maintain blood glucose and muscle glycogen throughout the shift. So that's short-term. And then he says, we've not done long-term studies on the effects of these meal types. Typically, when looking at long-term health, more of an emphasis is placed on vitamins and minerals and other micronutrients. When you look at long-term, a main concern would be what other ingredients are consumed with those carbs, such as saturated fats. There has been a considerable effort on the last revision of the food contract to have macronutrient structure, more fruits and vegetables, more vitamins and minerals, and better food quality to better support long-term health. And then he had to jump on a plane. He said apologies for his brief appearance and that he just didn't have control over the sound environment, but he appreciated the opportunity to participate. So let's see, I wanted to, Kat, you got another question in the chat box here that I don't know that everybody saw. And it said, have you all studied smoke affecting mitochondrial health and function? And if so, what did you find?
I did answer that in the chat. I just did it privately. Sorry. I haven't seen any study that's looked at that as a health outcome, but I was hoping to answer live the next set of questions around PPE and respirators.
Please do. Do you want to just repeat the question since we're getting low on time?
Yeah.
Yeah, go ahead.
So what about the lack of protection of lungs on wildland and prescribed fires compared to structural fires? It seems a lack of lung protection using respirators or particulate masks as a required PPE for wildland firefighters. And so I guess I wanted to discuss the use of PPE, but also kind of how we think about controlling hazards and exposures in our environment. So NIOSH has what's called the hierarchy of controls. So controlling the hazards and exposures that you have in your environment. And at the top of the pyramid, I'll put a link to it in the chat, but at the top of the pyramid is, substituting or eliminating the hazard. Then you go into engineering controls, which could be, increasing ventilation, but we all work outside, so we can't really do that. And then we have administrative controls and PPE. And as we move down this pyramid as well, we really start at the most effective controls and move all the way down to the least effective controls. So at the bottom of the pyramid is PPE, which is also our least effective control since it has a lot of human error involved into it. And, we all have to be good at using it at the right place and time. So right above PPE is where I really like to kind of hammer in is administrative controls and really changing how we work. Changing ways, thinking of ways that, daily you can reduce your exposure to smoke when the time and place allows. I know that every day is different and every operation is different. And so that's really going to change. But really what I try to hammer home is if we can, cumulatively reduce exposure, then in that equation that I showed, we can reduce dose, which then reduces risk. So as of right now, there's no PPE, there's no respirator that meets the wildland firefighting standard that's put out by NFPA. Cal OSHA is working on a respiratory protection standard and has kind of put together an advisory group for that. And we can share that information as well. But really, there's nothing that's out there on the market that's available to be used, in these not only arduous working environments, but extreme work conditions. So that's where I really try to hammer home of thinking of creative ways that we could really change how we work on a daily level so that we can reduce our exposure incrementally over time.
Thank you. It feels like we could have extended conversations on each one of these topics. Really appreciate the presenters today. We're going to have to wrap it up for now. I would encourage the presenters before you dive off, just double check that Q&A box and see if there's something else you can answer in writing. Randy, I see there was one for you that just came in. So a couple of reminders. The link for tomorrow will be different from the link for today. The event page, and also that registration link is still open. So if you know other people who might want to attend the next 2 days, feel free to share the link with them to the event page. And then also we're posting resources on the event page related to some of these presentations as they come in. And then also just remembering that it was recorded today, and as soon as the recordings of the presentations are ready and online, then all the registrants will get a link, as will the presenters, to that. So I think that's all I had for today. I hope you enjoyed the presentations as much as I did. I feel like there's a lot more to learn, and we will look forward to seeing you tomorrow. Thanks again to our presenters.